I was always a pretty active person, playing tennis, golf, was doing some small triathlons. I started to have pain in my lower back, hip, wasn't sure exactly what was hurting over the past 8 to 10 years. With the hip pain, it made it very difficult to perform my job. I went to see Dr. Gaukhman, and we found that I really had arthritis and needed the full hip replacement.
He was the ideal candidate for a total hip replacement. He's active, he didn't really have a lot of comorbidities. And so really, what we attempted to do is to improve his quality of life and bring it back to where it was 10 to 15 years ago before he started having pain.
Before having the surgery, I was kind of afraid of having hip replacement, feeling I was still too young to have that. But at the same time, being young is a great asset for the recuperation.
Total hip replacement has really been revolutionized over the last 20 years or so. We used to have patients stay in the hospital for over a week's time, so now it's more of a healthy patient model. They usually leave either the same day or the next day. But there's different ways to do a total hip replacement. There's different approaches or ways we get into the hip. An anterior hip replacement has been really touted as being much better recovery and a much faster recovery.
By going through the front of the hip, where they don't have to cut through any muscle, and we're able to walk again much faster than in the past. In the hospital, within a few hours, they had me get up of the bed, use a walker to move around the room.
One of the things that was really remarkable about John's journey was how quickly he was able to recover. Within 6 weeks, he was able to restart his activities of daily living and restart playing sports, doing running and jogging.
I'm extremely happy with this surgery. And now I'm able to go play golf. I could play 36 holes in a day if I wanted to. No more pain.
The advice I would tell patients who are having issues with their hip or knees is to seek consultation with an orthopedic surgeon sooner than later. The quicker you can get a diagnosis, the faster you can have a treatment plan set in place.
Go do it as fast as you can. If you have pain, don't be afraid to do this surgery, because it's going to change your life.